Hi, my name's Andrea, and I am a caseworker for a 15-year-old teenage boy named Brody. A little bit of history about Brody. He lives with his mom, Jamie, and two younger siblings. Since kindergarten through 10th grade, he's been placed in advanced classes due to above average testing scores compared to kids his age. Lately, he's been showing signs of depression and acting out. He has no history of drug use thus far, and we hope stays that way. Jamie came to me because Brody has been getting poor grades in school, picking arguments with teachers and other staff members, and not listening when he's being told what to do, which has been causing some major issues within school. Jamie thinks that Brody's behavior is worse than a normal teenage behavior and is afraid that the behavior is going to worsen if it continues. Based on what I've heard and seen so far, I have diagnosed Brody with oppositional defiant disorder, or ODD. ODD is an externalizing disorder and a conduct disorder. It's sort of a precursor for conduct disorder and can develop into conduct disorder, which is a much more serious externalizing disorder. ODD is diagnosed when a child does not meet all criteria for conduct disorder, but does display some of the symptoms. Symptoms of ODD include loss of temper, being argumentative with adults, repeated refusal to listen to adults when they give direction, annoying others on purpose, being too touchy or vindictive at times, and deliberately acting out. Brody shows a couple of these symptoms, such as argumentative with adults and refusal to listen. Treatment for this disorder can be similar to conduct disorder and can include family intervention, which consists of 3 sessions to familiarize, assess, and give feedback on child and parenting. It includes parent management training to teach parents how to react to child's behavior and teach reinforcing behavior. And also teaches proper discipline with children with this disorder. Multi-systematic treatment is another form of treatment which aims at adolescents, family, school, and sometimes peer groups. It recognizes family and individual strengths and identifies trigger for conduct in children. This treatment can be provided at home, in school, a therapy setting, or recreational centers. Prevention programs are another great treatment for this disorder. It includes a fast track program, and fast track programs identify problematic areas, aim to improve academics, social skills, and behavior, and can include peer relationships and parent-child relationships. My recommendations for Brody are to enroll Brody in a fast track program, which I just described, start a family intervention to help his mom and siblings understand his behavior, recognize triggers, and practice reactions that won't further trigger behaviors. I would also like to schedule meetings with teachers and school staff as well, so they can recognize behaviors and learn reinforcing techniques to try and decrease these conduct behaviors. We don't want Brody to develop into a conduct disorder that leads to criminal activity, substance abuse, anything like that. So I'm really hoping that these programs and therapy sessions can get Brody on the right track.